Hello, my name is Tarik Kalwar, and welcome to my presentation on how government policy impacts West Virginia's food insecure population. A little background on myself. I've been in food service, hospitality for over 20 years. I consider food a very intimate form of communication and truly an important part of my life. West Virginia has been undergoing significant demographic shifts. Between 2017 and 2023, the state's overall population declined by 2.5%, dropping from 1.8 million to 1.75 million. For the purpose of this study, I've chosen to focus on two of our most vulnerable and policy sensitive groups: youth under 18, seniors over 60. While the population of West Virginia's children under 18 has declined by 5.8%, from 373,000 to 351,500, our senior population has grown by nearly 3%, adding 13,858 more individuals ages 60 and older. These changes matter because they reshape demand for critical support programs, and they help us see clearly how policy decisions affect real people, especially those at the greatest risk of food insecurity. While 17% of West Virginians live in poverty, that hardship is not evenly distributed across the state. As you can see on this map, some counties bear a far greater burden than others, with pockets of deep, concentrated poverty that reflect both economic conditions and policy impact. In order to illustrate just how impactful policy is in our country, on our counties, we can hover over individual counties and we can see the total population of each county, the average number within that county living in poverty, and how that figure breaks down among our focused demographics. It is interesting to note that the Eastern Panhandle simply doesn't experience the same hardships as our much more rural counties. See, Berkeley County has a much higher population, but less than 14% living in poverty, as opposed to Southern West Virginia. McDowell County, for instance, less than 20,000 people live there, yet almost 36% are living in poverty. But what does it mean to live in poverty in West Virginia? According to the federal government, in 2023, a family of four earning $26,500 or less falls below the poverty line. To explore how government policy shapes the lives of those experiencing poverty, I've chosen to focus on a key federal program that directly serves food insecure households, the Supplemental Nutrition Assistance Program. The Supplemental Nutrition Assistance Program, SNAP, is a federal government program administered by the U.S. Department of Agriculture. The program was first introduced as food stamps in the 1930s during the Great Depression. At the time, Congress had just passed the federal income tax law and used that revenue to address rising hunger across the country. Fast forward to 2020-25, the current administration and House of Representatives have proposed deep cuts to key social safety net programs, including SNAP, as part of a broader push to enable a $4.5 trillion tax reduction. So how many West Virginians rely on this program? Well, since 2018, SNAP participation in West Virginia has consistently ranged between 275,000 and 375,000 recipients. But the 2019 government shutdown introduced a visible disruption, an anomaly we'll see repeated in the data throughout the presentation. The most significant recent shift happened in February 2023, when 23,041 individuals lost SNAP access in a single month. Over the course of 2023, West Virginia saw a total decline of 50,404 recipients. From 2019 to 2022, we see a clear downward trend in SNAP participation among older adults. Participation among youth remained relatively stable, fluctuating between 50,000 and 55,000, but the trend for older adults is more concerning, with a steady and sharper decline, dropping from over 83,000 to around 75,000 during the same period. This suggests that while support for younger individuals held somewhat steady, seniors may be at increased risk of food insecurity, especially as policy and eligibility rules shift. So when we look at the federal budget, the real picture starts to come into focus. The 2019 government shutdown, SNAP benefits were distributed early, so families could continue to eat. They were anticipating the shutdown. But when the government reopened, there was very little left to distribute, creating this temporary gap. However, in 2020, the COVID pandemic triggered a major shift. Congress authorized emergency SNAP allotments. They removed income limits, a marker for how much a household is allowed to get in support, thus allowing households to receive the maximum benefits based on the household size. This significantly boosted support at a critical time. But in 2023, the Consolidated Appropriations Act ended those emergency allotments. As a result, monthly SNAP distributions in West Virginia dropped from 87 million to 49 million. This policy change affected 25,000 West Virginians, cutting their benefits or removing them from eligibility entirely. That same year, the cost of living adjustment increased Social Security benefits. But since SNAP has returned to an income-based model, and many seniors are receiving Social Security income, they suddenly found themselves ineligible for SNAP support or a decreased amount of SNAP support. This budget decision had a tangible negative impact on West Virginia's most vulnerable, especially seniors and children. It's important to note the budget doesn't reflect how many people need food assistance, only how many will actually receive it. This chart compares the average SNAP cost per person in West Virginia in red with the national average in blue from 2017 to 2024. As you can see, both lines trend upward in 2020, reflecting the impact of COVID-era emergency allotments, which significantly increased benefit amounts across the country. In West Virginia, the average SNAP benefit per person peaked in 2023 to around $250 before sharply dropping after the emergency allotments ended. As of the most recent data, West Virginia's average SNAP benefit per person has settled to around $170 a month, which translates to roughly $320 per household, assuming there's 2 people living in a house. Notice that West Virginia's costs briefly outpaced the national average during the peak of the emergency period. But now, as benefits normalize, West Virginia has dropped down below the national trend. This sharp drop reflects the real on-the-ground impact of federal policy decisions, especially the termination of emergency SNAP benefits in 2023. So, while we can't predict how new policies will directly challenge West Virginia, we can see how past decisions have major impacts on West Virginia. The most recent House bill to apply more pressure on the impoverished, entitled House Concurrent Resolution 14, proposes significant changes to the Supplemental Nutritional Assistance Program that could profoundly impact West Virginians. H-Con Res 14 includes a proposed $230 billion cut to SNAP over the next decade. Such reductions will lead to decreased benefit amounts, stricter eligibility requirements, and increased administrative burdens for all states. For West Virginia, where a significant portion of the population relies on SNAP, these changes could lead to heightened food insecurity and a strain on local economies. This bill was passed on April the 10th at 11:11 in the U.S. House chamber. Now, as a data analyst, it's my role to present the facts, not my opinions. However, I often find myself walking away with a lot more questions than answers. For example, how accurate is the data on our population over 60? In a state known for its pride and self-reliance, many older adults may be unwilling to ask for help, even when they need it the most. And what about the hidden stories behind the data? How many seniors in West Virginia are quietly raising their grandchildren? Children who cannot advocate for themselves and rely entirely on adults for assistance. And beyond parents and guardians, teachers are often the next line of defense for children facing poverty and hunger. But policy decision makers rarely consider this network of silent support systems. Even my ability to explore and report on these issues has been affected. Recent policy changes made it more difficult for me to access poverty data, including limitations on the CDC's own database. Given more time and resources, it would have been valuable to explore data from the National Survey of Children's Health, available through the Data Resource Center for Child and Adolescent Health and the Child and Adolescent Health Measures Initiative. But even a brief look at their 2023 data for West Virginia, note in the data where respondents reported that they sometimes could not afford enough to eat. This figure underscores how food insecurity remains a persistent issue, not just among adults, but also among children, who often remain invisible in policy conversations. In conclusion, data gives us a starting point. It's a bit of a snapshot of reality, but it doesn't actually give you the full story. When we begin stripping away these systems meant to protect the most vulnerable people, we risk losing far more than funding. We risk the dignity, health, and future of West Virginians who may never appear in the data set, but who feel every policy change all the same.